NHS-based cardiac rehabilitation is quite a common process for the moment, but we don't really use it for atrial fibrillation. We mostly use it for patients with heart attacks or patients with heart failure. We've started using it for our patients with atrial fibrillation, and we found that in the short term it improves things like exercise capacity and also anxiety and depression levels. I think the advantages are quite obvious. There's lots of studies now that prove that exercise is helpful for most medical conditions, but particularly for atrial fibrillation. Patients end up being able to have better quality of life in terms of their symptom burden reduces. There's evidence that their cardiac function on echocardiography and other tests improve as well. And also it's better for their mental well-being. I don't think it's being used yet because current services aren't developed to use that patient cohort. But actually, with funding, I think that it should be possible to try and do this more widespread across the country. Well, we actually managed to identify some factors that contribute towards patients dropping out of our programme over the 6 weeks period. The particular factors that we did identify were very severe obesity levels, high anxiety and depression levels, but also reduced initial exercise capacity. And our next plan in Sheffield is to start systematically addressing those factors. So by targeting nutrition, by targeting mental health, by targeting diet and exercise, we hope that in the long term we can improve our patient pathway and improve patient engagement. Well, I hadn't heard of this event until I submitted to it, and from what I can see so far, it's a fantastic event. I think I've only been here about 15 minutes, but I've already met patients who have told me their stories. I've met other colleagues, and it's a great opportunity to network and meet similar people who are interested in the same topic.